or walking through the new grant management system, specifically for your fiscal people, because I know not everyone in this meeting is actually in the system doing claims. So if your fiscal people have any questions, feel free to connect them with me, and I'm more than happy to walk through. It's a learning curve for this new system, and I'm definitely still learning, so I don't expect anyone else to be experts in it yet either. All right, that's pretty much all I have. If anyone, is there any questions for me? Well, if anything pops up, definitely let me know, and I'm more than happy to work with you on it.
Thank you, Carla.
Thanks.
Perfect. So next we're going to pass it over to Katrina Miller, who is here to give us a brief check-in about the Oregon Infant Mental Health Association. Thank you, Katrina.
Yeah, thank you, Maria, and hello, everyone. It's great to be here with you. Before I jump into talking about ORIMHA, I just want to say that as many of you are aware, maybe all of you, we have the intent to award on our regional service providers has gone out, and that includes some of you. And we are looking forward, we're in the process of scheduling and looking forward to having individual meetings with you and moving forward to our next steps. I'm very excited, I'm looking forward to some great conversations. So on that note, then I'm going to transition to talking about ORIMHA, the Oregon Infant Mental Health Association. During the last year, actually it was when we were still ELD, so when I'm thinking in the past, it's hard to refer to ELD as DELC, but it was when we were ELD. We supported ORIMHA in bringing in a what they call the early childhood mental health endorsement. They already had an infant mental health endorsement, which is for the 0 to 3 professionals who work with the 0 to 3 population. They wanted to bring in the next age group, the 3 to 5 preschool endorsement process. So we were able to provide some funding to them to support that. And as part of that, we also had the opportunity to sponsor organizational memberships for community organizations, early childhood organizations that DELC works with to receive a ORIMHA membership. It's a 1-year membership, lasts 12 months, even though the grant that we have had with ORIMHA is almost over to align with the fiscal and the calendar year. We're offering this for 2024. So I'm going to share my screen. Looks like that works. I forgot to check in ahead to make sure that I could. Is everybody able to see that? Okay, great, thank you. So this is what ORIMHA says about themselves, how they describe themselves. They say, we are a statewide network of parents and professionals committed to supporting the emotional health and well-being of all Oregon infants, toddlers, and their families in safe and thriving communities. We're dedicated to promoting awareness and understanding of early nurturing relationships, building capacity to support emotional health and well-being, providing access to current resources, informing policy and funders, and advocating for the application of infant mental health principles and practices into our work and into our community. So sometimes there is a question that will often come up is, what do we really mean when we say infant mental health or early childhood mental health? So I wanted to offer, there we go, offer this definition and see if anybody recognizes it as a definition for something else as well. So what is it? It's the developing capacity of the infant and young child to form close and secure relationships, to experience, manage, and express a full range of emotions, and explore the environment and learn, all in the context of family, community, and culture. Anybody recognize this definition and where else it's used? This is also the definition of social emotional development. So the exact same wording, whether you say infant mental health or you say social emotional development, it's the same thing. And so when we're talking about supporting infant mental health or early childhood mental health, we're talking about supporting social emotional development. There's a slightly different lens and different approaches, but it's the same thing. We're working towards the same thing. So here's a little bit about the benefits of a RIMHA membership. So you get email announcements about resources, topics, policies, alerts, there are newsletters, upcoming events, trainings, conferences, the opportunity for networking and connecting with others. And then you get access to infant and early childhood endorsement. This doesn't, the membership, the organizational membership doesn't pay for the cost of the endorsement, but you can't access endorsement unless you have an ARIMHA membership, either an individual or an organizational membership. So what we're offering is that your organization, if you are so interested, can have a 1-year membership to ARIMHA at no cost to you. And it will grant you access to these things. I know that ARIMHA is planning some great 0 to 3 trainings. They're bringing some 0 to 3 trainings to the state in the coming year. And I'm pretty certain that that there's a discount. Not that the trainings would be free, but there's a discount to members in registering for those trainings. So if you are interested, there's a membership form to complete. It's very simple. It's going to ask you 3 questions: the name of your organization, the name of your primary contact, and the email of that contact. And then ARIMHA, this form will go directly to ARIMHA. Then they will reach out to you, the primary contact, and ask you for the names of all of your staff that you would like to have access to this membership. It covers up to, I think I forgot to mention it, up to 100 people in your organization. So let me drop the link. They are hoping, ARIMHA is hoping, so it's very simple on your end. ARIMHA is hoping to process this information within the next few weeks so that they can get those memberships up and ready for January. So if you are interested, please fill out that form, submit it sooner than later. If you have any questions, you can, and I will share these slides with Maria to send to all of you. But you can access the ARIMHA members, the website. There's also this membership email that for direct membership questions, you're also welcome to reach out to me. I think I see something in the chat. Good question. It's okay, a couple good questions there. So it is not available to all grantees at this point. We don't have enough memberships to go all the way around, but we If you have specific organizations that you would like us to consider, send me an email or send Maria an email and we'll chat. And the partnership, the hub is a partnership between the orgs. We probably have enough memberships we might need to check with RIMHA on that. And we probably do have enough memberships that we could support both organizations. Any questions? Any additional questions? Oh, yes, Kelly, good question. So this offer was also made to the CCR&R directors. If as is the situation in your organization, if you're the same organization, same backbone, then as long as 100 will cover you, then that would just be one membership that would cover everybody. If you're different organizations, then yeah, it has to be part of the same organization. That's an RIMHA rule. Renee, you have the same situation as Evan. Any other questions? I can stop sharing now. Didn't realize I was still sharing.
Thank you so much, Katrina. And if you guys think of other questions, feel free to reach out to me or to Katrina, and we can look to get those answered for you guys. Thank you so much.
Thank you.
All right. And next, I'm going to pass it over to Gabby and Karina, who are going to do our DELC strategic planning refresher, and then we will get going with that. Gabby and Karina.
Hi, everyone. Good afternoon. Almost said good morning, but I feel like I haven't looked at the time in a while. I hope you're all good. And I know I saw Karina.
Good. Hello, everyone. I'm here.
Oh, there she is.
Hopefully you can hear me. I'm gonna. Hi, all. I could hear you all on my headphones fine, but I think sometimes you can't hear me too well. So I'm gonna go with that. Good evening, not evening. Good afternoon, everyone. You can tell we're in December mode. What is time? Especially with the shorter days and whatnot. But it's a joy to get to join you all again. I know we were here, was it last month already? It's gone by really quickly. I know, Maria, you were out, but I think we did a reasonable job of making sure that everyone, felt welcome in the space, especially, we had Alyssa join us as well. So Gabby and myself are back this time just to do a brief recap about the strategic plan, which we touched on last month, and really wanted to shorten that component of it and dive more into actual conversation as we had discussed around some of the questions that we're working on for the strategic plan and doing some breakout rooms for that, allowing you all to share some thoughts, some reflections in dialogue with your colleagues, and then bringing us back to a shared space and being able to do some shared so that us as DELC staff can listen, just get clarity, and then we'll take that information and digest it for ourselves, and we'll come back in a few months before we finalize the strategic plan. But we have a few slides just for a recap for anyone who wasn't here. Gabby will kind of get us going with those, and we'll touch base. But if you have questions as we go through, again, this will be a little bit more of a succinct version. And I know the questions were shared out via email, kind of with the agenda. So I might have seen some of these before. But Gabby, do you want to?
Yeah, and hoping you guys can all see the correct screen, because I don't see the little green lines on my. Are you guys seeing the slides?
It's the PDF form.
Okay.
Form that you have.
The PDF for the. Yeah, that's perfect. And also really quickly before I forget, I'm actually dropping a link to a smart sheet in the chat. We're really wanting to actually track who we hear from and who we're talking to. So it's a pretty quick smart sheet. It's not asking for your name or anything, really just county, what partner group you represent. So you'll see early learning hubs. And you're able to select multiple of those. I know some of you are also part of the early learning advocate meeting, so feel free to select whichever group or groups best represent you. And then ethnicity and just today's date. And this is something that we really do just want to track who we're hearing from and just being conscious so that when we come back and reshare, we have that information and we're able to kind of track that. So I know you've all seen these questions and there are, oh, sorry, what we've previously heard. Sorry about that. You guys did see this. Let me go back to the beginning though, actually. Let me make sure that you guys can see.
We do have a
that.
quick question in the chat. It says,
Oh,
do
yeah.
you a resident county or the counties we work in?
Good question. Let's do the counties that you work in, because I know that with the hubs, right, it's sometimes a few different ones. So feel free to do which ones you work in, and if maybe even specify which one you specifically live in, just so that we can kind of cover all of our bases. And I actually think I want to start here with the timeline of engagement slide, because these are the same slides that we shared with everybody last month, but I do kind of just want to provide some updates and clarity on this slide. As you can see, right, in the December, January 2024 box, we were ambitiously thinking that we would be able to report back, but we are extending the gathering feedback information up through January. So like Karina mentioned, we will eventually be back to just share everything that we've gathered, but it likely won't be until, I want to say, late winter, whatever that might be, February, late January. It really kind of just depends when that lines up with all of your meetings, but do kind of just want to flag that these timelines did kind of change, except for the June 2024 date. That is still the anticipated completion date, because I believe the governor specifically mentioned that the strategic plans are due by June 1st, if I am remembering that date correctly. Again, wanted to highlight the what we've previously heard slide, and I know that this doesn't account to everything that we've previously heard in meetings. Oh, perfect. I just wanted to make sure that I didn't miss anything else in the chat. So increasing access to resources, expanding the network of support for families, embracing parents, guardians, and families, engaging in conversations and co-creation with the community, and expanding engagement efforts, in addition to the need for language and culturally diverse staff. And so Karina and I are here today actually to really do an activity with you all where we want to do breakout sessions. And it'll be essentially some small groups, and we have a Jamboard created, and we really want folks to kind of just, you know, in your small groups, feel free to kind of just talk amongst yourselves, but also use the Jamboard to really leave your comments, and comments, questions, answers regarding these 4 questions that we really want to focus on. Again, you know, thinking about the past year, what do you see as some of Del's strengths or greatest contributions? What are some of the most urgent needs for children and families? What's something that Del can do to support early learning and care providers? And thinking about Del's MVV, what would you like to see done in the next 2 to 3 years?
Perfect.
And then these questions are also on the Jamboard, so folks will have these in front of them. But before we kind of start sending folks into that, I think we're going to do about 15 to 20 minutes of these breakout sessions, and then we want to bring the group back and kind of do some share outs. So also kind of just to think about that, in case you guys want to designate someone to kind of do your share out for your small groups, that would be great. And anything else to add, Karina, or any questions?
No, I think you got it. I just wanted to, before we do the breakout rooms and I share the Jamboard link, if are there questions around, the strategic planning, the timeline, anything that we might have shared that you might have seen in the slides before we jump in? I kind of just want to make sure that folks feel a sense of clarity.
This is
Kelly.
Kelly. I have a question. Hey, is there going to be a DELC staff person in each one of our breakout sessions, or are we on our own to go through these questions? What's expected in our breakout session?
Thank you. Thank you. We will refrain from joining the sessions as DELC. So DELC will kind of be in this shared space. We'll stay in the lobby essentially, and y'all just kind of, I think our hope is that just a natural, organic conversation. I'll share the link to the Jamboard here in the chat now, which you can see. And so everyone should be able to add their own sticky notes. Those are anonymous, right? So you'll be able to kind of add those as a group. And whether you decide to nominate someone and have someone kind of be the facilitator or the note taker, we'll kind of just let groups run themselves. So we'll stay here, but once we come back, if there are questions, Kelly, or if there's some things that you really kind of just want to highlight or provide more detail for us as a large group, we'll have some time for that.
So we just need to find the page on the Jamboard that corresponds with our room. Okay,
yes,
got it.
So I'll go ahead, and there's plenty of pages there. I don't think we'll have 10 rooms. We have 25. We're going to do about 5 breakout rooms, and might give us a minute or something to reshuffle people if necessary. But yes, once you go to the Jamboard, just find the slide with the room number that you're assigned to, and we'll go from there. So thanks, Kelly. Thanks for helping me provide that additional breakout information. So I'm going to create these rooms, and it's automatically, there'll be about 4 to 5 people depending. I'll open the rooms, but again, I might have to do some quick reshuffling on some of these just to make sure that we don't have any outliers out there. So thank you all. We'll see you in, let's say, 20 minutes. And if you're done with dialogue and want to take like a quick break there before we come back, I mean, the time is yours. Let's do it that way. So it's 32, it's at the 52-minute mark, and then we'll take some time from there. And then just again, reminder for DELC staff, I think it might look like it's sending you over, but ignoring, you can stay here. 4, and then I'm going to move to hello, everyone, slowly coming back. Okay, well, thank you, everyone. Thanks and Jen, I see you have to drop off. Thank you for joining us. I'm not sure if they're gone already. Thanks, everyone, for sticking through. I will say that in the main room, we were having some I don't know, we ended up talking about just our terrible hair stories. So I think we've identified a next break, icebreaker, a conversation starter, and time flew for us. We hope you all had some good conversations, and I can see, the Jamboard and the sticky notes. So it looks like there was thoughts and some ideas on there, but I'd love to just really open up the room and allow folks to share, whether you have 1% from your group or others that kind of want to tap in. And then I think just to stimulate some conversation around in the room and just anything that maybe didn't get documented and that we can capture as well. So I'll be taking notes a little bit on what we hear and referencing back to the Jamboard, of course, but room is or space is yours. We'd love to hear a little bit about what you discussed and whether you want to do every question or, highlight a question or a thought, idea, reflection from your conversations. Anything is welcome. and I know you all can look through the Jamboard, so I won't screen share so I can kind of see faces, but if you want to just tell us what review we're in, and then we can kind of glance at that, and then people can kind of do that on their own if that's okay.
I'm happy to go first. So hi everybody, Evan Weaver. We're Fairly Learning Washington County, part of Washington County Public Health Department. We were in group 4 with Christy and Abby and Ron. And we talked about a number of things, but I think one of the things that we spent a fair amount of time on was kind of this space of the still, of course, lack of childcare that exists, but then the other elements of it being affordable, and then the availability of it in different income brackets. And the way that the federal kind of entitlement system is set up, that people often feel kind of restricted once they go beyond the 200% poverty income line, and sometimes will make choices to not make more money in order to stay eligible for benefits. And so figuring out ways that as a state we can kind of play with that and expand benefits for families where we have flexibility to. And then talking about just from a early childhood provider standpoint, the strain that's happening there, both from a staffing and workforce standpoint, but also the way classrooms are being comprised in terms of students and families who have a lot of need, whether that be social emotional needs or just social determinants of health and education needs, and the level of strain that can put on a provider without having a lot of additional resources to bring into that environment, and the concern that we have around those sorts of things. So those are a couple of things that we spent a fair amount of time discussing, and I would say if the group wants to call anything else out that I didn't mention, please free to jump in.
Thank you, Evan. For that last one, just wanted to get clarity, make sure that I captured, you're talking about the needs of families and children, and kind of the strain on providers, right? And kind of just naming that as an issue, or was there any, okay.
Well, the issue is like the classroom environment becomes, I think, difficult to manage the more families who come in with a lot of existing needs, and then needs that are identified while they first are enrolled in the classroom. And so from a provider standpoint, needing the level of professional development when you're managing a classroom that may have a lot of disparate needs within it, but then also the staffing that tends to be commensurate with that. Like if you say, look at an example of like a Head Start entity that has family advocates versus preschool promise classrooms that don't necessarily have that kind of FTE dedicated to it, things like that, right? Or we were talking about Christy as the example of being an educator, like in K-12, when you have high needs classrooms, you typically get a lot of additional resources that are deployed, and we're not necessarily in a place to do that. We're all our early childhood providers. And I think that's a continual struggle to figure out how to do that, because if you don't, you end up eventually losing.
You muted, Evan. I was okay. Thank you. That was really helpful, actually, just to kind of dive into a little bit more of the problems, and then if there were ideas, which I think in what you just mentioned, there's some ideas there too, right? If here are some things that would work, but we don't have access to right now. So we're providers. Thank you. I had seen, I don't know if it was Molly, if you had come off mute.
Yeah, I did. Thanks. Yeah, we were group 2, and our ideas are there on the Jamboard for everyone to read. We just really echoed a lot of what Evan's group was talking about, of the complicated situations families find themselves in when rent costs are really high, but the federal poverty level and state requirements for services are really low. And then the difficulty that families have in balancing that. One of the things we would love to see DELC advance in is figure out how to resolve that ERDC waitlist and funding shortfall. That seems like to us a really high priority for department. Another thing that we talked about just briefly, and it's on my mind still, is the awareness that we have as people who are active in the community of the intersecting factors that lead to long-term consequences for young children, like houselessness or addiction, or just poor health, or all of those sorts of factors that we were trying to think through, like where else in DELC do staff deal with that besides at the hub? I mean, in home visiting programs, you sort of have to by default, but it does seem like hubs are that place in the DELC system where the state is investing time and money through us in how do we look at that, where those sectors intersect and can support or can harm families, which is a big issue for the Early Learning Council, but it seems very targeted or very aligned with what hubs do, but not so much with the rest of the work of the department. It just, for me, it just sort of highlighted, oh yeah, we have a very odd sort of perspective on the work of DELC as hub directors, because we are basically community organizers and think about our work in a very different way than licensors or people that are developing, you know, even workforce development. So anyway, that was on my mind as a piece of how do we give input into a strategic plan when we're really thinking about great big picture and system pieces. And there was tons of other stuff, but we put it in the Jamboard.
Thank you, Molly. I'm taking that one in the reflection around how you hubs being system leads, right? And having that cross-sector, just very macro sense of communities and family and children experiences. And what I hear you saying is that there's perhaps it's a unique space in comparison to the other programs that DELC runs. Thank you. Now we had 4 groups. Thanks for your patience while we were shifting people out into the matrix out there. Anyone else who wants to either just add, you know, from these first 2 groups or the other groups, additional thoughts, reflections? Glance at the Jamboard again, just see if there's anything here that
Hey, this is Kelly. I have a thought because I'm kind of reading through the different room notes, and I'm noticing something, and I just want to say that this is a thought. It's not a complete thought. It's a half-baked thought. So I'm learning in public here. So I see several comments on here about increasing compensation. And as we have this conversation as hubs, I think it's really important that we pay attention to benefit packages. I really love what is going on with our CCR&R and I'm speaking, I don't know enough about this to speak very much, but the idea of encouraging people to have a savings account or a process of saving money for their retirement and having them think that direction. A lot of us take that for granted because it comes with our work. And as we talk about increasing salaries or increasing wages, I think it's really important that we look for other opportunities that support our early learning, our early childhood workforce. It could be benefit packages, it could be in-kind types of support. We're getting to a place where people are competing, and we see people move from program to program because they get $1 an hour more, and that just doesn't help kids, and it doesn't help our workforce. So I just want to think about the whole package, and when we submit budgets or propose budgets to the DELC, have the DELC support us in identifying the complete cost or the complete investment into that workforce, whether it's a program that we're contracting with or if it's an internal early learning staff member. Does that make sense? Rod is actually a lot more eloquent talking about this than I am, and so he will get more and more comfortable as time goes on, and as I step back.
Hey, Kelly. Go ahead, Gillian. I saw you go off.
Jillian, yeah.
Jillian.
To add to what you're saying, Kelly, I think we were talking in our group about equality of funding positions, because what seems to happen every legislative session is relief nurseries get more money, then people in Head Start and Healthy Families leave their positions and go to Head Start. Then relief nurseries get more money, and so then the Head Start people go to relief nurseries, and Healthy Families seems to kind of not keep up with anyone. And so and Hub too, Hub personnel. So would like to see equality across the board is what I think I hear you saying, Kelly, so that we're thoughtful about that, we value the people who are doing the work and they're able to stay in their positions if they desire.
And it can't be just the amount a person is paid per hour or the annual salary that we're looking at. We need to look at the whole package. And I think that we need to compare compensation more holistically rather than just the income that you pay taxes on. And gosh, I don't know how to say this appropriately, so help me. So some people that we are growing through the system, some of our younger, especially younger generation people, aren't thinking about retirement. And so it's up to us as leaders to also teach people to save for their future and to invest in different ways. It might be investing monetarily, but it also could be investing in their professional development so they can move up through the system.
Thank you, Kelly. I captured those thoughts here for sure. And I know you mentioned some additional edits to the Jamboard, which I'm trying to look at in my split screen, and it looks tiny for me, but thank you. Are there additional thoughts? I kind of really just wanted to allow space for additional reflection or again, highlighting anything that's really important, that was really important, or very loud and clear for your group. Laura, I see you're unmuted. I wasn't sure if there was anything you wanted to share. Okay. I see it now. Well, thank you. We'll go ahead and look through all of the information. We've done this activity also with CCRNRs. We'll be doing this activity with our advocates meeting, which we know some of you may be a part of. And since you know that, time is yours, so take the gift of time back for that time. But we'll be looking at this information, again, working through with other DELC staff around drafting an initial strategic plan and bringing some draft at some point, and just, here's a little compilation of what we've heard, and ensuring that we have understanding and shared meaning. So you'll hear from us again in a couple months at this point, but really, really do appreciate your time. You still have access to the Jamboard, so if there's additional thoughts that you kind of want to share, please do so there. We'll also follow up with a smart sheet that you can provide written comment into. And then I know there was interest for additional conversations or one-on-ones from folks. And so we've also created a bookings link in which you can set up some time with either myself or Gabby if there is more that you'd like to share, or if any of these comments, that you'd like to kind of dive into and just be in conversation. So I just wanted to offer those two other options as well, if it feels necessary. And that kind of concludes our portion of this for you. I don't know if there are questions that you might have. Gabby, I don't know if there's anything that we need to close with, but that was my...
Yeah, no, and I'm just resharing the smart sheet, which is separate than where you can provide additional comments. This one's specifically just for signing in, just to note that you were here and you provided some kind of feedback in case you joined late or didn't have access to it in the chat. And then also want to make a quick plug to this group where Karina and I will eventually be back once we kind of finalize some dates. But we are looking at holding some family engagement sessions to gather feedback as well. So we're working with our comms team to kind of come out with like a flyer that we're hoping to share with you all so that you guys can spread the word out to families. More to come on that. Our dates are still pretty tentative, but it will be sometime early January. So just wanted to bring that here, and more to come for sure on that. But really wanted to thank you all for your time today.
Thank you, Gabby, for that. Back to you, Maria. Thanks, everyone.
Thank you, Gabby and Karina. I think that's all we have for today. So thank you so much for joining us. I will gather everything that we heard from today and send it out in a recap email to everyone, along with the recording in case you missed any part of it. And we will see you guys in January. I know our January meeting is on the 2nd, so no worries if there's other things planned, but just if you're able to attend, we will be here. Thank you so much.